Peace be to all. Assalamualaikum. Omar here, physician associate, health educator, and endurance athlete. So today I wanted to talk to you guys about the importance of incorporating health education in your patient interactions. So I wear many hats. So one of them is a PA, and I work in a doctor's office. So I see just adult patients, so they are 18 years old and older. Most of the patients I see are over the age of 50. With that comes a lot of age-related diseases, and we call this polymorbidity if it's more than 2 or 3 diseases. So what I call the big three: so hypertension, type 2 diabetes mellitus, hyperlipidemia, so high cholesterol and triglycerides, and usually obesity also. Collectively, you may see this referred to as metabolic syndrome. I may do another video on that. But yeah, it requires a lot of education, a lot of encouraging the person to engage in positive lifestyle management. One of the things I like to do is use models when talking about different diseases that may affect the different organs. So for instance, poorly controlled type 2 diabetes mellitus, or you may hear it referred to as diabetes mellitus, depending on where you're from, and hypertension, so uncontrolled high blood pressure. It'll have deleterious effects on the kidneys after a while. So I want to show my patients, what a kidney is. So I'll ask them, do you know where your kidneys are? A lot of people point to their stomach, they don't quite know where they are. If you say the term retroperitoneal, well, what does that mean? So you have to explain it. So I explain also the vasculature of the kidney. If you can see this, the renal arteries and renal veins, then the ureter, and then the adrenal gland is on top of the kidneys. Kidneys don't actually look like this in the body. I used to help do autopsies about a little more than 30 years ago, and the kidney would be encapsulated in a layer of fat for protection. So they don't have this nice clean look. They've got to be cut out of the body and cut out of that fat capsule, and then this is what you'll see. But there's a lot that goes on with the kidneys. So I've got a lot of patients who've got chronic renal disease. Unlike in my hospitalist capacity, many of them may have acute kidney insufficiency, and that can often be brought on by infection or reactions to drugs or medications. So this is one of the models I use if I'm talking about heart disease, especially things like coronary artery disease. I like to use the model of the heart. So this has got the vasculature on it, the vasculature of the heart. I've got a number of patients who've got things like atrial fibrillation. So then that's the electric component of the heart. So I can open up this particular model and then point to things like where the sinoatrial node is located. So the so-called pacemaker of the heart. And then talk about things like Purkinje's fibers that go throughout the muscle of the heart. And you've got these things called ectopic beats. So a lot of people have not had that explained to them. Why are they taking certain medications? Well, that's the control for the electric component of the heart when it's not functioning properly. Things like heart attacks or myocardial infarction. Now, where does that usually occur? Well, I can point to the left ventricle and really show the people this is part of where that would occur in the heart. If I've got patients who have got heart murmurs, well, what is a heart murmur? Why is it occurring? Well, you can show them the different valves of the heart on this. And it's a nice model. I also have, this is I don't know if you can see this here. So I don't want to take the tape off. Well, I'll take the tape off of this. This is a model you can actually take apart. Take out the lungs. here. I take out the liver. I was explaining to somebody today, this person had issues with bile duct obstruction. So where is it? Where's the gallbladder? We're showing them, well, this is where it's located. Where's the liver located? Right under the lungs. So you may even have some referred pain and think that there's something wrong with your lungs because you actually have something wrong with the gallbladder. So this is just a nice way of showing people where the different organs are. So I find it to be helpful. Let's see, what's something else I use. I got a lot of people that come in complaining of stomach pain. Well, where's your stomach located? Well, if you start pointing to different areas, you can show them where the stomach's located, and you can also explain that somebody was telling me that they had heartburn. So I was explaining to them that heartburn actually doesn't have anything to do with your heart. Rather, the esophagus, I was telling them about the esophageal lining and how it's actually located. The esophagus is located near the heart. So when you've got gastric juices flowing back up to the esophagus, it's going to be near the heart. So they're not having pain in the heart. It's actually the part of the esophagus that's actually located near the heart. But the models help. This is a very nice model here. You can see, if you can see this, you can see the rugae lining in the stomach. You can see the musculature component of the stomach, the vasculature of the stomach, and then the pancreas, of course. And then that actually, I can even use this when I'm talking to my patients who've got type 2 diabetes mellitus. You talk about the islets of Langerhans, that's where the beta cells, where the insulin's produced. That stuff you learn in school. A lot of my patients, of course, being over the age of 50, they've got, some may have prostate issues. So I've got a model of the prostate in its various stages. So this is a normal prostate. You've got a prostate with, I have them palpate this model of the prostate that has a nodule in it. I'm talking a minute about benign prostatic hyperplasia, BPH. Show them what a enlarged prostate might look like. And then if they've got, unfortunately, I've had people die with a metastatic prostate carcinoma. So I show them what a prostate that has a lot of cancerous tumors in it will feel like and look like. And then, of course, the old digital rectal exam. You can see that here. This is the sagittal section, what that entails. So you'll see Proscard. This is one of the medications that's often prescribed to people with benign prostatic hyperplasia. This is funded. Some of these models have actually got the name of pharmaceutical companies on them. I hope I don't get in any trouble with with YouTube, but the pharmacies used to be able to give us clinicians models just for teaching purposes. I don't even know if they're allowed to do that anymore, just with restrictions that pharmaceutical companies have had placed on them. One of the other things that I like to use for health education is the classic anthology of anatomical charts, if you can see that. So this one's got anatomy in it. So again, you can tell people where their organs are. There's the skeletal anatomy, and you've got different dermatomes. I've had patients with things like shingles. You start talking to them about dermatomes. Here's the liver, and same thing with liver disease. I've had, when I was doing my hospitalist work, I had patients with they had cirrhosis of the liver. secondary to long-term alcohol use. So I really didn't have the opportunity to do a lot of teaching there because I was so busy. And you may find yourself very busy in a doctor's office. But yeah, I still think it's important to make time. You can always bill for it. Turn a 10-minute visit into a 20-minute visit, because it's important to make sure that your patients understand what's going on with their bodies, and that can really have an efficacious effect in making sure that they adhere to the different medication regimens and treatment regimens. Here again, this is what I was talking about, gastroesophageal disorders. I see a lot of GERD, so gastric esophageal reflux disease. Here again, I can use this in conjunction with this. There was an old movie with Tupac Shakur, of course, the slain rapper. I think he was playing a drug addict with another actor, and they were going to stab themselves so that they could they were addicted to opioids. So they were trying to figure out where their liver was so they could stab themselves, and just give themselves like a little stab in the liver, and then go to the emergency room and get some opioids. And that's another thing. I deal with patients who have had a history of opioid abuse, so I've got to educate them about the importance of eschewing opioids and opioid overdose. I've already had people come in and try me like, yeah, I need some pain medication. That doesn't work. I need Percocet and oxycodone, all this other stuff. So, yeah, again, education's important. And then I just educate them on the dangers of opioid abuse. They probably already know it because they've suffered from it by the time they see me. But anyway, I hope that was helpful for some of you all. If you're interested in being a PA like me, understand that it takes about 6 years. Well, it takes 6 years to become a PA. So you're going to need a 4-year undergraduate degree. Many people will major in nursing or maybe respiratory therapy, or get a straight science degree in chemistry or biology. Mine is in biology. Then you take the GREs, the PCATs, and take your let's see, I think you want to spend maybe about a year getting direct patient contact hours, and then apply to PA school. Hopefully get interviewed, and Lord willing, get in and get through, pass your PANCE, your physician assistant national certification exam, and then go into the world of medicine and do great things. If you want to be a doctor, 4-year undergraduate degree, 4 years, take your MCATs, 4 years of medical school, take your step 1, 2, and 3 of the USMLE, United States Medical License Exam, and get into residency. If you want to do internal medicine as a physician, then you're going to have to do a 3-year residency. But internal medicine, I find it very relaxing yet challenging. Challenges me intellectually, and I enjoy my interactions with the patients. So if you want to do that, and then becoming a health educator. I have a doctorate in health education, and I took an exam called the CHEST exam, which is that's the certification exam to become a certified health education specialist. You don't have to do that to incorporate health education into a part of your patient or client interaction, but I just chose to do it. I wanted to have that extra degree of, no pun intended, that extra degree of expertise, and also do more for my patients. All right, guys, that's it for now. I wish you guys the best of success in your positive endeavors. If you're fasting, observing the month of Ramadan like me, we're in the last 10 days. So I wish you Ramadan Mubarak. I hope you found this helpful. Subscribe if you want. If not, that's too cool. That's cool also. Take care. Peace.